The major types of health plans as we know them more today. One is called a health maintenance organization, or HMO. The other is called a preferred provider organization, sometimes referred to as a PPO. Let's take a look a little bit here at HMOs. They are referred to as a service plan. It is a network of physicians that are on salary through the HMO. You can only use an in-network physician in an HMO, or the plan would not pay for an out-of-network doctor. It works on a prepaid basis. You pay a set amount every month. The member selects a PCP, a primary care physician, and you have to run all medical things past that doctor first, even to get a referral to maybe a specialist. All has to go through your primary care physician. Another word for that physician is a gatekeeper. He or she is there watching that gate. They're kind of controlling the costs and making sure that you're not having unneeded things treated and operations that aren't required and things like that. It encourages preventative care. It was the first type of health insurance ever to stress preventative care. Well baby exams, mammographies, smoking cessation plans, things like that. They realized that if we help our clients stay healthy, we're not going to have to pay so many claims. So it was cheaper for the company to start stressing these preventative care routines, and it was better for everybody. Preferred provider organizations, or PPOs. They are also a type of a service plan, like an HMO. They have physicians and hospitals that actually contract with the insurance companies to accept their clients in as patients. They offer a fee-for-service. You pay them for what they do. The primary care physician or referrals that have to go through that primary care physician do not happen in a PPO. So it's kind of one of the major differences between the two. They have what is called in-network or out-of-network providers. If you go to a doctor who is in-network, the insurance company will pay more of the claim and you will pay less. The opposite happens if you go outside the network of doctors. Now, you may be willing to do that, pay more, because you have a favorite physician and you just don't want to give that doctor up. This plan would allow you to keep your favorite physician, but understand, if they're not in that network, they haven't contracted with the insurance company, then you're going to pay higher fees and rates to get that care from the doctor who is not in network. Consumer-driven plans. These are maybe some of the newer types of coverages that are out and about these days. There's three major types. There's an FSA, an HRA, and an HSA. We're going to compare and contrast some of the features here. For example, eligibility. Who would be eligible for an FSA? All employees, unless you're self-employed. You cannot take advantage of an FSA. On an HRA, all employees can take advantage. And under an HSA, individuals covered by a high deductible health care plan, they are not also eligible for Medicare. Remember that. Who has to be covered by a health plan? Do you have to take out an FSA? No, you do not. An HRA, do not have to take it out, and neither the HSA. It's totally up to the individual to decide if they want this type of coverage. The contributor on an FSA is usually the employee. Sometimes it's the employer, or sometimes even both are able to contribute. It's just how the plan is set up. The HRA, it is strictly employer only. And on the HSA, it can be the individual or the employer, one or the other. Contribution limits. There are no statutory, meaning state law required limits. Limits may be set by the employer. Under the HRA, there's no statutory limits either, and limits may be set by the employer, also just like the FSA. On the HSA, annually specified limit, regardless of the plan's deductibility. So that's slightly different. Okay, so be aware of that. And carried over funds, meaning you put money into these plans pre-tax during the course of the year. Let's say you're getting to the end of the year and you've got money in your account. What happens? On an FSA, the funds don't carry over to the next year. So it's one of those, you better use it or you will lose it. You want to make sure you spend all the money in that FSA account by the end of the year, or maybe into the first month or so of the next year, depending upon the plan. You have to get your receipts turned in. Now, an HRA, funds do carry over, and on an HSA, the funds carry over also. So remember those differences. The FSA is the only one that doesn't carry over.